On the 15th of March, the Men's Health Forum in Ireland and the HSE launched a new report that examines why middle-aged Irish men have the highest rate of suicide of all age groups in Ireland. The report was funded by the HSE's National Office for Suicide Prevention and produced by the National Centre for Men's Health at the Institute of Technology in Carlow. It sets out a series of recommendations for what can be done to reduce suicidal behaviour in middle-aged men. The aim of the report was to explore the factors underpinning the higher suicide rates among middle-aged men at risk of marginalisation. At the end of the day, I caught up with a number of the participants from across Ireland and internationally, and I asked them what it was stayed with them from being at the event.
My impressions, very much, I suppose, the whole impact in terms of really looking at men from a very holistic perspective. And while we focused on one particular area today, it's very much in the context of men's health overall. And so I think it was a real opportunity to explore that in more depth, but we need to keep it in that framework. But hugely energising and hugely touching stories and hugely beneficial research, all really contributing to the agenda as we move forward.
I'm really conscious of men taking their own lives. It's something that visits me on a regular basis, and I don't look at the numbers broken down by age. I just see the total numbers, and I think that it doesn't turn up in the detail, but I'm absolutely convinced that post-recession we're living with an impact. And from what I heard today, it really brings in a focus around middle-aged men. Here we are. I'm not working anymore. I'm retired. I'm now officially older. But at the time when all those pressures are on us as men to be a provider, and if I was born in the 50s, so a middle-aged man was born in the 60s, he was taught his job was to provide, put food on the table and a roof above the heads. And if they're not doing that, what is it that they are doing? How can they be men? How can they see themselves as men?
Yeah, absolutely. I mean, Ireland is a lead, and I mean, the woman from the World Health Organization said that to me this morning, and many other people from other countries who are here said that to me this morning. Look, I was sitting there going, after the report was presented, thinking, resources, and of course every organisation like our own and all the other organisations here today are going to say the same. But it really is about investment in the country, by investing in the work with middle-aged men who are at risk. It is an investment in family, in community and in society, and it will, if you're looking at it from an economic point of view, which the government has to do, of course, it is an investment in the country that will pay dividends, and it does reduce the cost of things, but it also produces men who are only at middle age, still have half their life or more to live, who are then able to get involved in this society, in the community, in the family in a much greater and more positive way.
Well, first of all, I really appreciated the level of kind of interest and energy in the room and the breadth of input that we were getting from people, and being in a place that has a men's health policy, and has that level of commitment to look at gender and its impact on areas like suicide was really motivating and kind of gives us something to try and get to the same level on. And so that was something I suppose that was quite striking, which was there was real commitment from senior players in your health system, as well as from civil society, as well as our friends in Men's Health Forum Ireland and other men's organisations in Ireland, to make the day a success and to really drive forward an incredibly important agenda.
Yeah, no, it's really pleasing to see the report finally being published today, and from the Irish Cancer Society's point of view, it's really interesting in that so many of the themes coming out of the report are important to the Cancer Society as well. I mean, we know that while we're focusing on mental health today, physical health is equally as important, and the prevention of cancer. And this particular age cohort, middle age, are particularly of interest to the Irish Cancer Society in that a cancer diagnosis often takes place at this stage of life. And so we're particularly interested in trying to reach men middle-aged men in the same way as we're hearing today in the report. So there's a lot for us to learn from this as well. There's a lot of synergies. It's really important for us to try and find new ways of communicating with men, to reach men, to make our services more user-friendly for men of this age bracket. So it's really important, and delighted to be part of it today.
I guess my main impression about the day is just how much energy and enthusiasm there is for men's health work in Ireland. I mean, I know this is a continuation of work that's been going on for some time now, linked to the development of the men's health policy, the original policy, and then the new policy, Healthy Ireland Men. And I think it just shows how much work has been done here, how good a lot of it is, or much of it is, and how much commitment there is to taking this work forward, both from the Department of Health, the Health Service Executive, and also from NGOs operating in Ireland as well. So I'm really impressed by the extent and the depth of commitment to working on men's health in Ireland.
So today very much was about, I suppose, giving men's health organisations a roadmap as to how to work best with middle-aged men, and some of the recommendations around advocacy and communication, which is a key piece when it comes to working with men, connections, working in partnership and collaboration. They're all key areas now that we can work towards for the future in men's health.
Well, that's really positive. If you look at, first of all, the group of international experts identified Ireland. That's really important. It's really important that we're seen as shining a light on this issue. Part of the work is to actually unpack what works, why does it work, but actually to have the bravery and support to say what doesn't work in this area and why does it not work. Whilst the panel said that Ireland was the place that was leading on this, what we need to ensure is that men across Ireland, north and south, feel that Ireland is the place that is leading on this. And that's the next area of work.
What stays with me from today is I'm coming at it from a physical activity perspective, and we want to get people walking. We heard a great presentation today of the importance of social connections in men's lives, and it really, to me, the value of walking as a modality of this social connection. We're empowering men by means of walking, but it's not just the walking that is the message. I suppose it's the chat and the camaraderie of walking beside each other that's important as well.
I feel inspired, and to be honest, I think Ireland has got so much going for it in the fact that it's talking about these issues, it's creating reports on these issues, and it's pulling together days like this where we really see not just what the problem is. That's easy to state the problem, and I think lots of people at the point where they state the problem, they're not very good at finding solutions. And I think what Ireland is doing is finding a way forward. And I think that is the most important thing for me. I'm inspired because it's showing us that there is something out there that we can do positively. And the way that the guys were talking before, all those videos that were on, or the play that was on, demonstrates a willingness of Ireland to embrace their men's health and to support their men's health. And I think that's the most important thing for me.
Because of the man I am and the way I approach the world, I've seen all those different pictures in a slightly fuzzy way, and it has brought a huge amount into really sharp contrast. The thing that delighted me most was listening to Shane, and it was just to hear a young man speak about men and manhood the way he did, reaching into his heart and speaking from that authentic place. And I said it to him. So somebody said to him, you know, his father is a lucky man. And I said to him, well, actually, he's the lucky man to have the father, because he didn't lick it off a stone. He got that heart and spirit from within his family, because you don't pick it up. You don't pick it up.
Well, I suppose, you know, we tend to look at the very big picture, so it's nice to come along and see some of the more detailed and kind of qualitative data, particularly in the report today, when they're looking at very, small numbers of people and very individual experiences. I suppose sometimes we get lost in the very large numbers, so it's nice to get that feel for the smaller groups, and individuals.
Yeah, really, really delighted with the day. I think, as you say, the tone was set from early on about, being very respectful to the topic. It's a very challenging and difficult topic we were grappling with today. I mean, the issue of suicide in middle-aged men. And I think that tone that you talk about was established really from the outset of the project, not just, in the publication of the report. So, and I did acknowledge that today. I think we were well supported by a really excellent advisory group with a lot of really good experience in the area, and who helped us kind of navigate through difficult, stages of the report where we encountered men who'd obviously experienced very traumatic life experiences. Some men had attempted their own lives. So as researchers, that was a really challenging issue to deal with and to work with, and to do it in an ethical way, and to make sure that the participants we were working with weren't left bereft or not supported after the research. So I certainly would hope that we got that tone right today, because, as I mentioned in my presentation, the issue of suicide impacts on all our lives. It's not something that's confined to a few, unfortunately. It's something that most of us had some experience at some stage. So it's really important to treat it with the respect that it needs and deserves, I think.
What stays with me from today is it's probably one of the first conferences that I've been at around men's health that brought out the emotional issue a bit stronger. Like, one of the highlights of the day was the group from Derry, which was a play by a group of men who've come through mental health difficulties themselves and come out the far side, and they made a play from it, and it just really connected with everybody's emotions. Whereas normally when you go to a conference, it's all from the neck up, isn't it? So this is one of the first conferences I've been at where people's emotions were also tapped into and came into play.